All right, class. So, okay. So looking at blood transfusion, I did mention in my previous lecture that when talking about transfusion, donor's antigen is important and recipient's antibody is important. So here we have a negative person donating to a positive person. Being A negative, this person's RBC has A antigen on the surface and anti-B antibody in the plasma. The recipient, being A positive, has both A and D antigens on the surface of RBC and anti-B antibody in the plasma. So how will the transfusion be? Will it be a successful one? Let's take a look. So the donor giving blood to the recipient, and recipient's antibody is important, right? So this recipient has anti-B antibody, and the donor's antigens are, the donor only has A antigen, right? And they are not same. So we have A antigen reacting with anti-B antibody. Obviously, it's fine. There will not be any clumping, no agglutination. So this is a very, very good transfusion. Now, what will happen if the donor is A positive and the recipient is A negative? Is that compatible? Let's take a look. Okay, so now we have A positive donor who has both A and D antigens on the surface of RBC and anti-B antibody in the plasma. The recipient, being A negative, only displays A antigen on the surface and no D antigen. And the recipient also has anti-B antibody. Let's take a look at the transfusion. Okay, so the recipient has anti-B antibody. Donor has both A and D antigens. So the antibody B will not be able to react with either A or D antigen. So the first transfusion is fine. However, I want you to think of something. The recipient's body has never encountered D antigen before. So D antigen is very, very foreign to the recipient. And remember, our body makes antibodies against foreign materials or foreign antigens, right? So the recipient's immune system will consider the D antigen as a totally foreign body or a totally foreign antigen, and it will make some anti-D antibody in response to that. So after the first blood transfusion, the recipient will have both anti-B antibody and anti-D antibody in the plasma. That's okay. But what if this person needs a second transfusion in the future? Can that happen? Yes, a patient might require a second blood transfusion. How will that look? Okay, so we are looking at a second transfusion. The recipient already has both antibodies and he's getting blood from the donor. The donor has both A and D antigens. Look, you have D antibody and D antigen. Therefore, so you have D antigen in the D antibody in the recipient, which will react with the D antigen of the donor's blood. Same antigen plus same antibody. Bad agglutination, right? So a second transfusion will be bad. So if I want you to think about, if you are a health professional and you are, dealing with a patient, with a negative blood type patient, will you really recommend A positive blood for an A negative patient? No, it's not compatible. Okay? All right. Moving on to other scenario. Here we have O negative donor giving blood to A positive recipient. So O negative, meaning there is absolutely no antigen on the surface of RBC. The donor has both antibody A and antibody B in the plasma. The recipient, being A positive, has both A and D antigen on the surface of RBC, and he has anti-B antibody in the plasma. Let's look at the transfusion. So the recipient has anti-B antibody. Donor has no antigen. Yay! So anti-B antibody has nothing to recognize and bind to, right? Therefore, this is okay. The donor has not any antigen in the first place, so that's absolutely fine. And class, I want you to draw out the same thing that I have done, like a donor-recipient situation. And if you really play around with the different blood types, you will see that O negative, since it has no antigen on the surface of RBC, O negative blood can be donated to all other blood types. Therefore, O negative is called universal donor. So O negative is universal donor. Okay. Another situation. We have a B positive person as a donor and the recipient is O negative. Okay, let's take a look. A B positive will have A, B, and D, all antigens on the surface of RBC, no antibody in the plasma. The recipient, being O negative, has nothing on the surface of RBC and both anti-A and anti-B antibody in the plasma. Let's look at the transfusion. Remember, recipient's antibody is important. So recipient has these antibodies and donor's antigens are important. This donor has all three types. Bad. Anti-A will react with A antigen and there will be agglutination. And then the anti-B antibody will react with the B antigen of the donor and there will be agglutination. So obviously not compatible. Good. And if you try practicing these different scenarios, you will end up with this chart. Listen carefully. I do not, for heaven's sake, do not memorize this chart. No. The reason why I drew out the donor recipient scenarios is for you to understand how to handle the question. So if in your quiz or lab practical exam, I ask you, okay, quiz or lecture exam or wherever, if you get a question like this, okay, this person is O positive and this person is donating to B negative recipient, is that compatible? Why or why not? Justify your answer. For questions like this, you should be able to draw out the donor, the recipient, antigens, antibodies, and then with arrows, you should be able to figure out whether it's compatible or not. If you are my student, I want you to expect thinking about the situation or thinking about the transfusion and go from there. Please do not try to memorize this chart. All right. Now let's say you are working at a lab and you are testing blood samples of patients. And here we have 4 different blood samples as you see on the column on the left hand side. You don't know their blood types. You are trying to determine the blood type of the patient. So for the first one, you take the sample and when you add anti-A antibody, you see clumps. When you add anti-B antibody, the blood is fine. And when you add anti-D antibody, you also see clumps. When do you see clumps or agglutination? If you have the same antigen and same antibody, right? Antibody. That's when you have clumping. Okay. So if anti-A makes a blood clumping, so what type of antigen is present on the surface of RBC? If you think it's A antigen, you are good. So the blood sample has A antigen on the surface. So what will be the blood type? A. Now let's think of the anti-D situation. When you add anti-D antibody, you also see clumping, right? So obviously there has to be D antigen present. That's why the anti-D antibody are reacting with the D antigens to produce a clot. So this person is A positive. Similarly, if you look at the second sample, with anti-A, no clotting. With anti-B, there is clotting. So it has to be same antigen, same antibody, right? So B. And also when you add anti-D, there is clotting. So there has to be D, same antigen, same antibody. So this person is B positive. Using this logic, I want you to solve the third and the fourth blood samples. And you might get a question like this on your exam. Okay, talking about RH and pregnancy. Now, the RH negative blood type can be critical for women, especially when they want to get pregnant. Let's say a female has RH negative blood type, and the fetus is having RH positive blood. By the way, this is modern art. I am just showing you the tummy of a pregnant mom. Okay, so the fetus is RH positive. Now we know that during fetal development, the antibodies from the mom cross the placenta and reach the fetus, right? So, however, during childbirth, at the time of birth, there can be a little mixture of the mom's blood with the child's blood. So that's a problem. The child is positive. So the child has D antigen on the surface of RBC. So the child has D antigen on the surface. The mom's blood has not been exposed to D antigen before, right? So the D antigen is very foreign to the mom. However, after the blood gets mixed, mom's system or the woman's system builds some anti-D antibody in response to that anti-D antibody, and this is called sensitization. The woman gets sensitized to D antigen, so she builds up the anti-D antibody. That's okay for the first pregnancy. However, a serious problem can arise if she gets pregnant again. Let's say the same woman gets pregnant the second time and the fetus is positive. Now think about it. The female has anti-D antibody in her plasma, right? These antibodies can cross the placenta, get into the fetal blood, and the anti-D antibody will react with the D antigen on the surface of the RBC of the fetal blood, and there will be clumping, and that will result in breaking down of the red blood cells of the fetus. So again, I repeat, the anti-D antibody from the mother's blood can cross the placenta and go to the fetal blood, and these antibodies can destroy the RBC of the fetus, a condition called erythroblastosis fetalis. To prevent this, there is a medication called Rogam. So doctors give shots of Rogam at about 30 weeks of pregnancy. And what Rogam does, this medicine, it blocks the D antigen of the fetus. It kind of covers up the D antigen of the fetus, so the mother's antibody cannot destroy the RBC of the fetus. So that's one way of saving the child or the fetus from erythroblastosis fetalis. I'll stop here, and that's the end.